Hello everyone. Happy Mahashivratri and happy International Women's Day. This time's theme is uh, invest in women, accelerate progress. This theme emphasizes the critical role of investing in women's education, healthcare, economic empowerment, and leadership development to accelerate progress towards gender equality. The idea, this time's campaign theme is inspire inclusion. So I request the management and all the women to be included in all the activities, and the management should encourage them for inclusion. The women also should take active participation in hemophilia chapter activities, advocacy everywhere. So when we inspire one other, we understand the value of women's inclusion, and we forge a better world. So thank you and welcome to everyone. Welcome Prem, Ramu Gadkar, all the EC members and all the participants, and our speaker Dr. Rucha Patil. Welcome, madam.
Well, thank you.
Thank you, ma'am.
Yeah. Now I request our HFI President, Mr. Prem sir, to address the participants.
Thank you, Satya. Happy Mahashivratri, and very, very importantly, a very, very warm and happy Women's Day. Women in our hemophilia community are the cornerstone. I totally believe that the women are a cornerstone. They are the strength which we as PWH revolve around. You know, whether it's a mother or a wife or a daughter or a sister, they play a big, big, big role in uh, motivating us, molding us to the people we are. So huge respect today and every day to every woman in our community. As a person with hemophilia and as the president of the organization, I totally believe that you are the cornerstone, and we are always here to support you and help you to the maximum extent we can. And today we have Dr. Rucha with us, and we often talk about the importance of role. And I hope and I pray that we will all work towards a time when every woman in our community can make an informed decision and are totally trained to mold the next generation. Thank you so much, and sorry for the disturbance here.
Yeah, thank you, Prem sir. Thank you for your kind words and keeping trust on us and believing us. And your continuous support is always there for us, being in the community. Thank you so much for that. Now I request our VPD, Mr. Ramu Gadkar sir, to speak a few words.
Yes, namaste. Thank you, Satyasri madam. Thank you. Respected President Prem Roopji, respected Dr. Rucha madam, respected Mrs. Indira madam, Women Chairperson, Dr. Anuji, Natraj, Samar Singh sir, and respected all HFIC members and सभी participants का मैं इस आज के इस इम्पोर्टेंट वेबिनार जो इंदिरा मैम ने अरेंज किया उसके लिए सबका स्वागत करता हूं आने के लिए और सबको मन से धन्यवाद करता हूं। आप सभी को जागतिक महिला दिन की हार्दिक शुभकामनाएं देते हुए महाशिवरात्रि की भी हार्दिक शुभकामनाएं मैं यहाँ पे दे रहा हूँ। हमारा जो डॉक्टर इंदिरा मैडम ने अभी कहा कि इस साल का जो थीम है उस थीम के अनुसार हम महिला दिवस साजरा कर रहे हैं, महिला दिवस कर रहे हैं। तो उसमें हमारा आज का जो थीम था, आपने HFI का वेबसाइट पे महिला दिन का एक स्लोगन डाला हुआ था, वो मैं जस्ट पढ़ के बताऊंगा। रक्तस्राव विकारों में होने वाली चुनौतियों से हमारी महिलाएं योद्धा के रूप में उभरती है। रक्तस्राव विकारों में होने वाली चुनौतियों से हमारी महिलाएं योद्धा के रूप से उभरती है। प्रतिकूल परिस्थितियों को सकारात्मक व सशक्तिकरण में बदल देती है। आइए शक्ति और उपचार की यात्रा, इस यात्रा में एक दूसरे का समर्थन और उत्साह करें। बहुत अच्छा टैगलाइन इंदिरा मैम ने बनाया। मैं इसको बहुत मतलब आज सुबह से इसको पढ़ रहा था और बहुत अच्छा मैडम ने लिखा है। मैडम, एक रिक्वेस्ट था आपको कि हमारे रीजन में जो कर्तृत्ववान महिलाएं है, उनका आज वुमेन्स डे के दिन में बहुत सारी महिलाओं का अलग से अलग अलग संस्थाओं ने सत्कार किया है, उनका एप्रिसिएशन किया है। तो मैं भी रिक्वेस्ट करूंगा, आप उन महिलाओं का नाम हमें भेज दे, हम स्पेशल HFI की तरफ से सत्कार करूंगा। कुछ नाम मैं यहाँ पे लेना चाहूंगा। आज गोवा से सरिता चौहान मैम का स्पेशल एप्रिसिएशन हो गया गोवा गवर्नमेंट की तरफ से। तो ऐसे बहुत सारी महिलाएं हैं जो अभी हमें जस्ट पता चल रही। तो ऐसे महिला का नाम अगर आप देते HFI को, तो हम स्पेशल एप्रिसिएशन HFI की तरफ से करेंगे। तो बहुत बहुत धन्यवाद इंदिरा मैडम, आप मुझे आज के इस इम्पोर्टेंट वेबिनार में इन्वॉल्व करने के लिए। मेरी तरफ से आप सभी को महिला दिन की वापस एक बार हार्दिक शुभकामनाएं। थैंक यू सो मच मैडम। नमस्कार।
श्योर रामू सर, हम लोग जरूर ये करेंगे। हम सभी का, हम लोग हमेशा इवन रिपोर्ट में लिखते हैं, अगर किसी ने कुछ अचीवमेंट किया है तो हमें भेज दीजिए। तो हम कलेक्ट कर रहे हैं। अभी रिसेंटली मुझे एक ईस्ट से एक आया है राउरकेला चैप्टर से, वो मैं शेयर करूंगी और हम जरूर उनका सत्कार करेंगे। थैंक यू फॉर योर सजेशन।
यस, थैंक यू सो मच।
Thank you, Ramu sir. Now I request our women chairperson of HFI, Mrs. Indra Nair ma'am, to give an introduction about our speaker, Dr. Rucha Patil.
One second. Yes.
Ma'am,
Dr.
one second, ma'am. Before that, Saurabh wants to take 30 seconds of time.
Yes.
Yes, Saurabh.
Yeah, thank you so much. So today is a Women's Day, right? तो एक बहुत अच्छी स्टोरी मुझे यहाँ पे याद आती है कि आके लक्ष्मण जो थे ना, आके लक्ष्मण, उनका इंडिया की सबसे बड़ी बड़ी जो न्यूज़पेपर्स है उसमें कॉमन मैन करके एक आर्टिकल छपता था, या फिर वो कॉमिक स्ट्रिप छपती थी। तो किसी ने उनको पूछा कि आप कॉमन मैन का पब्लिकेशन करते हो, कभी कॉमन वुमन का पब्लिकेशन क्यों नहीं करते? तो क्वेश्चन काफी लाजमी था। तो आके लक्ष्मण ने जो उस पे जवाब दिया वो मुझे छू गया, दिल को छू गया। उन्होंने कहा कि आदमी जो होता है ना वो कॉमन हो सकता है, लेकिन औरतें जो होती है, विमेन जो होती है, वो कभी कॉमन नहीं होती, वो हमेशा स्पेशल होती है। तो every woman is unique, powerful, and deserves the recognition. That's why we are celebrating today's day. And this is the truth we should acknowledge. And everywhere we should value, respect, and celebrate their contributions. So today is the day we admire whatever the women are doing in our community. So thank you so much, all of the women group, all the persons who are doing good, nurturing their families well. And thank you so much for calling me today for this event, and wishing very best and successful webinar. Thank you.
Thank you, Saurabh, for wishing us, and we are blessed to be in this community and privileged to being recognized. So thank you so much. Yeah, ma'am. Indra ma'am, you can just take over.
Yes. Thank you, Saurabh, for your kind words. Am I audible?
Yeah, ma'am, you are audible.
Okay. Dr. Rucha madam is she is a PhD, and her current position is Scientist C at Department of Thrombosis and Hemostasis, ICMR, National Institute of Immunohematology, and Indian Council of Medical Research, Ministry of Health and Family Welfare. Her other positions is she is a member of Indian Society of Hematology and Transfusion Medicine. She is also Secretary of Mumbai Hematology Group since 2019. She has received 3 international awards and 10 national awards, and her research her research areas of interest are technology development, wherein she had assisted in point of care tests for hemophilia and BWD, and has successfully developed others like those for GGPD, COVID-19 antibody, etc. clinical studies and trials, recent studies, including bleeding assessment in carriers of hemophilia and low dose of emicizumab for hemophilia patients, and has many studies to understand the development and prevalence of inhibitors in hemophilia. She is also internationally recognized hemophilia comprehensive. Her institute is recognized as internationally recognized hemophilia comprehensive care center. She is the member of one of the two internationally recognized hemophilia comprehensive treatment center and is a part of projects. She is one is World Federation Hemophilia Twinning Program in country HTC Twinning, and the other one is World Federation of Hemophilia, Hemophilia Federation of India, Path to Access to Care and Treatment PAC program, laboratory training workshop in different states in India. She is a PhD and MSc guide in Mumbai University and has currently 2 PhD students and has supervised 7 MSc students by thesis. Thank you, Saurabh, Prem, and Ramuji for your kind words and for your motivation. As always, over to Satya, please.
Thank you, Indra ma'am, for your beautiful introduction about our speaker. Now I request our speaker, Dr. Rucha ma'am, to take over the session. Before that, I would like to congratulate her for the awards and for all the achievements related to hemophilia. And also, as ma'am said that she has been recognized as International Comprehensive Care Center, where she is one of the member. So I congratulate her and thank you for your continuous support, ma'am, for the community. Now I would request you to take over the session.
Thank you. Thank you so much for that excellent and very sweet introduction. I'll just share my slides before I start. Okay. So first, I would like to thank Indira ma'am for giving me this opportunity to talk about this topic, which is very dear to me, that too on International Women's Day. And as always, I thank everyone, Prem, Ramu sir, all of them have always been with us, accomplishing all our research works or even everything for the benefit of our group. So thank you to all of you. And now coming for today's topic. Why I chose this topic is today is International Women's Day, and it is a reminder for all of us to realize our potential, that is as women, and create a world where every woman and girl feels safe, are looked after, are given opportunities to grow and are empowered. But all of this first starts with ourselves, that is our health. If we have our health good, only then we can do a lot for the community. So that is why I decided this topic, that is the importance of identifying and laboratory testing in women with bleeding disorders, because all the women who have hemophilia patients, yes, we have hemophilia kids who we have to take care of, but even the women need to take care of themselves. That is what I want to put in today's message. So, one second. Today, I'll be going over these topics, that is an introduction, hemophilia carriers, prenatal and carrier testing, when, why should it be done, our experience when we talk to women with mild and moderate bleeding, a preliminary result of our mini project which we did, and what we found out, the myths of the mothers of hemophilia sons, and what should be done by them. So as you all know, we are Department of Hemostasis and Thrombosis who have been offering diagnosis for a very long time. We not only do the diagnosis for all the bleeding disorders, but we even do prenatal and carrier testing for our patients. So coming to carrier, let's just talk about the basics right now. Who is a carrier? So we all know that all ladies, that is women, have 2 X chromosomes and males have 1 X and 1 Y. So a female who carries the hemophilia mutation in one of her X chromosomes, she is protected by the second normal X chromosome. And that is why she's called a carrier. And that is why she doesn't have as much bleeding as a hemophilia male. So this is what a carrier is. But why test for carrier status? Why should a lady come to us and say, yes, I want to know my carrier status? This is because when a carrier mother, she marries a normal male, no affected, not a hemophilia. What happens is when she reproduces, she has 50% of chances of having a carrier daughter and 50% chances of having a hemophilia son. So if she knows her carrier status, as soon as you get pregnant, you can do a prenatal testing. What is a prenatal testing? We test whether the fetus, that is the bachu, in the stomach, that is the fetus, is affected, that is whether the fetus has hemophilia or is unaffected. So based on this, you have a choice of abortion. This is completely you and your family's decision, depending on the treatment available, whether you can afford it and everything. So this is the family's decision, but at least you have a choice of this. So when I say a female should come and screen, who should be screened in the family for carrier status? Now, this is something that all of you should know. That is what is obligate carriers. That is, they are 100% carriers. You don't have to even check whether they are carriers or not. So these are daughters of hemophilia father, a woman with 2 hemophilia sons, a woman with 1 hemophilia son, and another relative in the maternal side. So these carriers are 100% carriers. They can directly come when they are planning for pregnancy. But the women who are potential carriers, that is, the carrier test has to be done because they may or may not be carriers. These are sisters of hemophilia patients, maternal cousins, aunts, and all close relatives of a hemophilia patient. So, one second. Very important question, which I'm going to stress upon later. Do carriers have a risk of bleeding? About 30%, that is out of 100 carriers, 30 of these women will have less factor levels, around 40%. And these are the women who need to be looked after. It is very essential for each and every carrier to know her factor levels beside her carrier status. Now, why is this very important? I'm going to go over at the end of it. First, we will finish off with the carrier and prenatal testing. So the next question which would come to your mind is, okay, I have decided that I want to do my carrier status, or if I know my carrier status, I want to do a prenatal diagnosis when I'm pregnant. So how is it done? Most important is the hemophilia person in the family has to have a very good report. That is a complete report. It cannot be only factor VIII levels. It has to be factor VIII levels along with the VWF antigen level. Why is this important? It's because factor VIII is a completely different gene and VWF is completely different gene. And for you all, you should know that when we screen for the factor VIII gene, it takes 4 weeks because it's such a huge gene. And if you are not doing the VWF antigen levels, there are very high chances that you are a von Willebrand disease. And we have wasted 4 weeks in looking at the factor VIII gene. So this is why it is very essential that the index case, that is a person with hemophilia, has a complete report. So before the prenatal and carrier, the index case can come to us. We can diagnose him for sure whether he's hemophilia and von Willebrand, and then we can talk about genetic testing. This is what this slide portrays. That is, for genetic testing, you have to have a complete laboratory report. We have to have a family pedigree. When I say family pedigree, it means in the entire family who all had hemophilia, or if not diagnosed, who all had bleeding issues. And along with these two is when we can go ahead with the genetic testing. So, normal questions which are asked for carrier diagnosis. Who are the essential family members? So once you have decided to do carrier testing, who all need to be present for that carrier testing? This is very important because with only the female's blood, we cannot do anything. We need the hemophilia person in the family, the mother of the hemophilia person, and the female who wants to know her carrier status. Now, you may ask why, or you may expect 3 separate reports. This is not why we take the samples. So what is generally done is we check for the mutation in the hemophilia patient of the family. And that same mutation is then checked in the mother and the female who wants to know her carrier status. rather than screening the entire factor VIII gene. So this becomes very feasible, and that is why these samples are very important for the genetic test. The next question would be, what is the ideal time to get tested for carrier status? Now, carrier status can be done anytime, but why do it when the girl is young or small? So generally what we advise is before getting married or before getting pregnant, come to us for your carrier status. Now, the problem which comes is majority of the women come to us when they are already pregnant. Now, as I said, the factor VIII takes time to screen. So when they are pregnant, this becomes very crucial and the time for testing becomes very narrow. That is why we always urge every woman to come just before getting married or just before planning to get pregnant. This is the best time to do your carrier status. Now, very important, because we've seen many women having a factor VIII levels, and based on their factor VIII levels, they are called carriers or not carriers. This is highly inaccurate and completely wrong, because 60% of our carrier females who are known carriers have normal factor VIII levels. So do not conclude if you have normal factor VIII levels, you are not a carrier. This is completely wrong. Coming to the pregnancy test, that is the prenatal diagnosis. When should you do it? Who should be coming and what you should be doing? Very first of all, if you know you are a carrier, okay, what you should do is as soon as you miss your period or you found out you're pregnant, you do a sonography report. This is done with a gynecologist. Why is this important? It's because based on that sonology report, we give you an appointment. Why is this required? It's because the prenatal test is done in the 10 to 12th week of gestation. So this is what is there in your this sonography report. So when you go to the gynecologist, they'll tell ki aap abhi you are 7 to 8 weeks pregnant. So based on this, we calculate when your 10 to 12 weeks are there and we call you for an appointment. This is called as the chorionic venous sampling procedure. Now, by chance, many times the lady informs us that they are pregnant very late. So even we can do a diagnosis in second trimester in the 15th to 16th week or in the 18th to 19th week. But we do not prefer this. Why is that? Because the risk is more when the gestation is more. And that is why the ideal time is the 10 to 12 weeks. So as soon as you miss your period, as soon as you come to know you're pregnant, you need to go to a gynac, get the sonography report and call us immediately. Okay, so these are, as it's written down, the risk increases. So the question for this topic is, are there any risks associated with sampling procedure? Now, what sampling procedure am I saying? It is the fetus sample. So you need a radiologist and a special doctor to remove the fetus sample, that is the bachu inside sample. So 0.8 to 1.6 risk of abortion during this procedure, but we have found none during our experience. However, when you become late and come to us late, the chances of abortion increases. That is why come as early as possible to us for the pregnancy test. The next question would be, again, who are the essential family members required for antenatal diagnosis of hemophilia? Very important, again, is the hemophilia person in the family. This can be the brother, the father, the cousin, maternal uncle, but we need one hemophilia person who is properly diagnosed, a complete diagnosed blood sample. Then the mother of this hemophilia person and the father of this hemophilia person. And the CVS, that is the fetus, the bachu's blood, which is done by a radiologist and sonologist. So with all these samples, we can find out whether the bachu is affected or unaffected. Can a carrier diagnosis or antenatal diagnosis report be kept confidential? This means that is it told to everyone or only the person which matters? So let me tell you, all the reports are kept very confidential. Only the mother and the father of the bachu will be given the report. No one else, not the mother-in-law, not the father-in-law, not even the mother-father of the female. Only these two get the report from us, and if they want to share, they can share it with the rest of the family. Now, coming to carrier and prenatal diagnosis. Now, this is the laboratory issues which I would want all of you to know, because what happens is many times you give the sample to us and the report is expected like in 1 week or in 5 days, which is impossible because, as I keep stressing, the factor VIII gene is very, very large. It takes a lot of time to screen for the mutation, at least over 10 to 20 working days, which goes on to 4 weeks if you go to see. But what we assure you is, if the mother wants to take or the family wants to take the decision to abort if there is an affected child, you need to get this report before 20 weeks because till then you can abort. We give it way before time. So around the 16th to 17th week, we do give the report no matter what, so that the decision can be made by the family. Now, coming to the wrong thinking. What are the wrong thinkings which happens in the patient's mind? Okay. So in a hemophilia family, if a lady has 2 or 3 normal sons, can she be considered as a non-carrier? The answer to this is absolutely not. I showed you the chart before. This is just luck, chance, fate, whatever you want to say, that this female has had 2 or 3 consecutively normal children. But it doesn't mean that she's not a carrier. She still has to be tested. Very important. Next question, which is asked. Can we know the sex of the fetus? Absolutely not. We all know that this is a criminal act, that is the sex of the fetus. The only thing that will be given to you in the report is affected and unaffected. If it is affected, it is a hemophilia male. If it is unaffected, it could be a normal male, a normal female, or a carrier female. No carrier report at that point will be issued. It will be issued only later on in life when she's 18 years and elder, as I said. Now, sometimes, unfortunately, what happens is in families, the hemophilia person has expired. So how to offer a diagnosis when there is no hemophilia? Because I keep stressing that for any of these tests, you need a hemophilia person sample. So what if this person is not there? So what happens is, as I said, how the procedure goes is, in the hemophilia person, we first find the mutation. It's easier in these hemophilia males. And after finding the mutation, that same mutation is checked in females, in carriers, in the bachchu, in the fetus. Now, when index case is absent, we can still offer, but it takes more time and the accuracy is less. So this is something which we report in the report itself down, that the accuracy may be low. And one thing, many mothers come to us, many families come to us saying that our whole family nobody had hemophilia, nobody had a bleeding disorder. So how come? And they don't want to sometimes accept that they have a hemophilia child. Now, the thing which about hemophilia is 30 to 40% of the cases of hemophilia is spontaneous. So what is spontaneous mutation? It means that the mother did not have the mutation. She is normal in both the X chromosome. The father is normal. But during the pregnancy, sometimes spontaneous mutation occurs and a hemophilia child is born. So this happens in 40% of the cases, and that is why such cases do occur. So I have gone through the hemophilia carrier and prenatal services and the questions which may be asked. Now I want to stress upon the women and our experience when it comes to women with mild and moderate bleeding, majorly the carriers. So as you know, we have been offering prenatal and carrier diagnosis for more than 2 decades. This is the first child in 1996 which was offered the hemophilia diagnosis, the prenatal diagnosis. Now, in our entire, so those who have come to us for prenatal know that we fill this one form. And in that one form, we have this one question to the mother. Okay, this is the mother that is a carrier female. Any bleeding that you have seen in yourself, that is nosebleed or heavy periods. And let me tell you, 90% of the time, the female says no. However, when their factor levels are done, we have found 10 to 20% have low factor levels. Okay. Now, why are these women saying a no to the bleeding disorder, or do they really not bleed, or what exactly it is? This is very less studied in India. Now, why is this so? Why are we not giving attention, or what is the status in India? The thing is, we have severe hemophilia A patients, and we all know that the treatment, the bleeds, everything, we are focusing on them because we have still not reached a quality of life of A level for them. So we are trying very hard to get the severe hemophilia patients to lead a normal quality of life, a good quality of life. The same go for women with severe bleeding, that is the von Willebrand disease. Our heart and soul is there for them, trying to make them get them the maximum benefit, maximum treatment. But in all this, there are few women who have mild and moderate bleeds. They have been ignored. So there is a very, very important need for prenatal and antenatal testing, awareness among women that they can get tested, awareness among women of bleeding, and if they do bleed, they have to go to the doctor for treatment. This is something which is lacking because we are not paying attention. So what we did is we did a very small study. Why we did a small study is because all of you know that ISTH has come out with a new nomenclature for hemophilia carriers. Okay, and what they have shown is that they are hemophilia carriers, that is abroad. Majority of them, they complain of heavy menstrual bleeding. And this results in constant pain in the lower body. They have iron deficiency. They have lack of energy. They may affect day-to-day life, and day-to-day activities. And majority of the carriers have lower factor levels. They have other kind of bleeds too, like minor wound bleeds, or when they go for tooth extraction, they bleed more, bleed after surgery. So as you can see, this is the international report on international, that is the outside India carriers. So you can see 70%, 65% have menstrual bleeding, that is heavy bleed during period, and they have bruising and oral cavity bleed. So why are our women, when we ask them the question, when they come for prenatal, they say no bleeding at all. So the ISTH guidelines, basically, they have divided the carriers also into different types. So based on the factor levels, they may be classified into mild, moderate, and severe hemophilia carriers. And if their factor levels are even normal, they have still divided them into symptomatic and asymptomatic. So we wanted to see whether this nomenclature proves right for our Indian hemophilia carriers too. So we included hemophilia A carriers who had the factor VIII mutation. So these were major carriers who come to us for carrier treatment or for prenatal. So all of them were entered and we made them fill this bleeding history form. And we asked them many questions and we did their factor VIII levels. So till now we have enrolled 54 women of the age of 22 to 72 years. And 48 of them are hemophilia A carriers and 8 are hemophilia B. And majority of them again are saying no bleeding episodes. Few of them are saying menorrhagia and ecchymosis. Ecchymosis means bluish black bruises on their body. So again, despite of calling them, majority of them are saying no bleeding episodes. So this is our chart. When we did 54 hemophilia carriers, there were 13 females who had low factor VIII levels. So they are mild hemophilia carriers. When it comes to the patient, the women who had normal factor levels, only one was symptomatic. So what we believe now, what we are observing in these carriers and you people, and that is why this is what I want to stress upon. We believe that there may be some myths in the mothers of these hemophilia sons. What is happening is these mothers, they are so, as Saurabh rightly said, they are very strong and they fight so much for their hemophilia sons. They are constantly running around for trying to do the best. So they compare their bleeds with the hemophilia son. Now, let me tell you, their hemophilia son is a severe hemophilia. So they will always have the joint and elbow swelling. However, the mother may bleed, but she considers her bleed as normal or she ignores her bleed because she's fully invested in her son. They do not have time to assess their own bleeding issues, and most of it, especially for period, that is the heavy bleed, they assume that these bleeds are normal or not significant. So this is the myth which has to go, and they need to be aware that whatever, even if there is a minor bleed or whatever it is, they need to report it. Because why is this most important? So what have we done is now the questions have to be reframed. That is what we have realized. So there are basic questions like nosebleed and bluish black pads. But when it comes to menorrhagia, we have to ask the number of days that the periods last for, the number of pads they are using each day. It is only then we realize, yes, they are bleeding heavily when compared to normal. Then important point is you need to observe yourself during a dental. All of us go for tooth extraction or something. During that time, do you bleed a little more? Because what our assumption is that hemophilia carriers will be very, very similar to a mild hemophilia patient. So a mild hemophilia male who comes to 6 to 40, if you see them also, they hardly bleed. They even are diagnosed when they are 30 years of age. That is when they have their first dental surgery. So this is similar to that. The only difference is since women have period and their menses start, they may actually observe a heavy bleed from the time of their menses or their periods. So each woman needs to assess themselves properly. A must for all the carriers: assess yourself properly, check whether you bleed, do not ignore it, come to the come to the doctors. You may not need any treatment every day, but if you are heading when you're old, if you're going for some surgery, a normal surgery, say knee replacement or any other surgery, you may need factors. And that is why it's very important to know your bleeding score and your factor VIII levels. This is the must for each and every carrier. With this, I would like to end this talk. This is a poster which was there by the World Federation of Hemophilia. And I like their motto, recognizing all bleeding disorders. And I'm highlighting women because women, at least in India, are not, especially the mild and moderate ones, are not being assessed properly. So we need to look after them too. Thank you. This is my entire team, all with me, who are trying to do the best for this community. Thank you so much.
Thank you so much, ma'am. It was inspiring and more informative too. Now, can we go for the question and answer part?
Yes, please.
Yeah, so there's one question saying that what is the common or uncommon symptoms of hemophilia carriers? How to know?
So exactly, as I said, hemophilia carriers, they are women. So it is just basic bruising, that is kala neela dhabba. You have to just check whether you're getting bruises very normally or on a slight hit. You should not get the bruise on a slight hit or something like that. So those are the things. So you're not going to have an uncommon bleed, but mainly this. And as I said, during your menses, during your periods, you need to see how many days, how many pads you're using, and you need to share this with the clinician or the doctor or to us, because we would know whether this is normal flow or a heavy flow. These are the two most important. Other than that, it has been reported there is one carrier who's had a joint bleed, but this is very rare. This is when their factor levels are very low. Like recently, we got one hemophilia carrier who has factor levels of 1%. So she is going to behave like a severe hemophilia. So get your factor levels done. That is most important. But if your factor levels are in normal, main thing is the bruising and the periods.
Okay. Thank you, ma'am. Now, the second question here is, father is hemophilic and daughter is pregnant. So daughter factor level is 110%. Her question here is, who we know baby is hemophilic or non-hemophilic?
So
Do
see,
we
as I
know
said,
that?
based on the factor levels, you will never know anything. So let me tell you, father is hemophilia, she's saying. So the daughter is 100% a carrier. As I said, obligate carrier. She comes into that. Okay. So the
Yeah.
daughter's factor levels, as I said, 80% of the chance the carriers have normal factor levels. She is an obligate carrier, remember. So she can again produce a hemophilia child. And you will never know until you do the genetic test. So you cannot answer this question until the genetic test is done. So over here, the myth, that is the assumption, because she has normal factor VIII levels, that she may have a non-hemophilic bachu, is completely wrong. Until you do the genetic test, it's not going to happen. You would not know.
Okay. So I personally have one question here, ma'am. As you
Yes.
said that obligate mother will have two hemophilics sons, whereas in the same family, if two sisters are there and they are not carriers, will there be a chance of having a hemophilic child? Though the medical report says they are non-carriers. Will
No,
there be
meaning who is the hemophilia person in that family?
brothers?
Okay, so if the brother is, the two sisters may or may not be carriers. They need to check that when they come to that point.
Yeah, if the report says that they are non-carriers, so they do not have to have that
No.
fear in them.
Nothing, absolutely not. If they are non-carriers, they are non-carriers. Nothing will ever change. They can go on smoothly.
Okay, yeah. Thank you, ma'am. Now, Anita, ma'am, you had a question. Can you please type your question here?
Or she can ask.
Yeah, please
raise
unmute.
hand. Yeah.
Unmute your this thing, and you can ask a question.
I'm not. Hello. Good evening,
Yeah.
मैम. मैम मुझे पूछना है कि अभी आपने बताया कि प्री नेटल डायग्नोसिस हो सकता है, तो प्री नेटल डायग्नोसिस में अभी नया एक कुछ तो प्रोसीजर आया है कि यू कैन मीन्स जैसे इंजेक्शन देते हैं वैसे हाथ से भी ब्लड निकाल के आप कर सकते थे. इज इट करेक्ट मैम?
No, yes, it is correct. That is called non-invasive prenatal testing. So that has not happened for hemophilia. As I said, factor VIII gene is very huge. So that is why even if you see gene therapy, the gene therapy first started with factor IX, then only it moved to factor VIII. So the non-invasive method has not come for hemophilia yet because it is very, very difficult. I don't know whether you all know, but there is one mutation called as inversion. Okay, this inversion mutation is the most common mutation, which is like 50% of the hemophilia patients. And to do the testing of this inversion, you need a very good amount of DNA, which is got from a good amount of blood. So that is why in hemophilia, non-invasive is very difficult. So I don't see it coming also, and it has not yet come also for hemophilia. For other genetic disorders, it is coming, yes.
Okay. I hope Anita ma'am's doubt has been cleared. Your question. So there's one more question here, ma'am. By name Nidhi. She's asking, like, her daughter is carrier with a normal son, but now she's getting weak with losing weight. What kind of test to be done? Test
No.
should we go forward?
There is
It
no
is not
test. She's a
related to
carrier.
hemophilia.
Yes, it's not related unless she is becoming weak. Now losing weight is a different part. If she is becoming weak because she has any bleeding issues, she needs to come to again Chandrakala ma'am, us. That is fine. But if it's nothing to do with bleeding, she needs to go to a normal doctor and get her test done. Let it be a CBC, a normal checkup, sugar, everything other than the bleeding.
Okay.
Losing weight has nothing to do with the bleeding disorder.
Okay. So there's one more question here, ma'am. By name Neha. She is saying that she has a menorrhagia since quite a young age, probably around when she was at class 8 or 9. Bleeding takes prolonged time to stop after getting tested for anything, or when she gets hurted, easily having black bluish spots or tear-like impressions on shoulders, arms, hands, or thighs. And she carries heavy things when she carries heavy things. And should she proceed to get tested for herself, or should she consider that she is affected?
So I would want to know, meaning since she's joined the session, someone in her family would be hemophilic. Is she a carrier? Or is someone in her family a hemophilia?
Madam Neha, could you please answer for this?
Okay, I will till she answers. If there is someone in her family who is hemophilic, there are high percentage of chances that she is a carrier. So she needs to come, she needs to get her carrier status done and even her factor VIII levels. That would explain everything. But yeah.
She's saying that no one are there as hemophilics in her family.
Okay, then yet she should, because she has such a bleeding this thing. Don't presume that you are, but come to test. Since you are a lady, there are chances that you are a von Willebrand, maybe a mild, moderate, but we would assess you properly. So yes, she needs to get tested before considering anything.
Okay.
So just come to us for a test.
Yeah, quick question here, ma'am. One more. She is a wife of PWH by name Mega. And in our next generation, as per her understanding,
Yeah.
our daughter will be a hemophilia carrier.
Correct.
So she wanted to ask that what should be the ideal scenario that she can think or plan as a couple about her pregnancy, and guide her as she's framing the question incorrectly. She's asking that whether it could
No,
be wrong
I
also.
think I understood what she wants to say. So see, she is a normal female who is married a hemophilia person. So over here, all her daughters would be carriers, but all her sons would be normal. Okay. So over here, the scenario is all her children are normal. See, we consider carriers are normal because they are not severe. So there is no requirement of abortion or taking care. As I said, carriers need attention, but it is very mild bleeding and they are like moderate hemophilias. So you don't have to consider any planning for pregnancy, because as long as you know all your daughters are hemophilia carriers, and by the time they grow up, you can see how excellent, let it be the treatment, let it be gene therapy, we are progressing. By the time her girls grow up and become big, you have no idea what has come out over there. So there's no tension over here. So she can just go for normal pregnancy. If it's a boy, it would be healthy. If it's a girl, she'll be carrier. Look after her. The carrier female, 90% is going to be not have any bleeding issues. So that's all okay.
Yeah, cool, man. So there's one more question here. One Omkar is asking that prenatal diagnosis is available only for hemophilics or any other bleeding disorders. If so, could you please name them?
We do it for von Willebrand disease too. We do it for GT, Glanzmann's thrombocythemia. We do it for other bleeding disorders too. There are few which we don't do it for, but basically anyone with a bleeding disorders approaches us and then we see what to do with it. We've done it even for factor 13 cases. So it depends on the family history. As I said, whether we have an index case with a report, then things become easier.
Okay. And here Sahana is asking that her son is hemophilic and she is a carrier, and she has twin sisters who are not carrier. And she doesn't have any brothers, and her mother also has no brothers. So women can also be a
Yes.
carrier by
Yes,
spontaneous
yes,
mutation.
yes.
Yeah.
So spontaneous mutation, which I said, could either result in a male getting affected or a female getting that mutation during her birth. So either can happen at any point, but it's spontaneous.
Okay. So Ladli ji, you had a question. Please go ahead. Ladli ji. Okay, there's one anonymous question, ma'am. Twin sisters of hemophilic brother. What are the chances of her to be a carrier?
Again, I can see they come into potential carriers. They may or may not be. So it is the same. Let it be twin sisters or let it be one sister. All of them need to be tested. They are not obligated.
Okay. Could you please mute yourself?
लाडली जी आपके से नॉइज आ रही है.
Yeah. Ladli ji had one question, ma'am, but unfortunately, there's a lot of disturbance over there.
Okay.
So please go ahead, ma'am. Sorry for the disturbance.
No, it's the same. It's just like twin sisters, one single sister or n number of sisters, they are potential carriers. You cannot predict anything. They have to come and get tested along with their brother.
Oh, okay. So as we are closing question and answers part, so we will be moving on to closing session. Before that, I request everyone to open your camera so that we'll click a picture.
सबने अपना चेस्ट तक का एरिया दिखे ऐसा कैमरा प्लेस करना है. हरप्रीत सिंह जी, ये फोटो ऑनलाइन पब्लिश होने वाली है. थोड़ा सा आप ठीक से बैठ के अगर कर सके तो अच्छा रहेगा. हरप्रीत सिंह जी. ठीक है.
So once done, please let me know.
No, still people are turning on their cameras. I will wait for 10 seconds.
Okay.
Okay, I'm clicking a picture now. Smile, everyone. Just a second. Move. Smile. Yeah, done.
Thank you, Saurabh. Yeah. Ma'am, there's one last question. Quickly, I'll just take it over. The same person who had asked Sahana, she is saying that as she's a carrier and her sisters are not carrier, should their daughters be tested for carrier? Should they undergo for the testing?
No, the sister has got tested, right?
I don't
She's saying
think
her
so.
sister is a non-carrier, or is she
Yeah, not a
presuming that?
carrier. Maybe she's assuming that. As no one are there, so she's assuming. Maybe that could be the
So see,
problem.
basically the sister needs to be tested. If you're sure shot she's a non-carrier, then no need of her daughters to be tested.
Okay. And there's one more question asking about the medication. Is how about the Hemlibra?
I cannot comment on that. So see, in the end, they're all going to work together, right? Let it be Hemlibra, let it be a Factor 8. We have to use all of them side by side, time to time. So nothing is better than the other one, just that Hemlibra is working well. I'm not going to say no, but it's a new drug. We don't know what is going to happen in the future. Factor 8 is known. We've been working with that for ages. So we know that doesn't have any issues or something. So we are still trying to do research on Hemlibra to say, yes, it is better or worse, or it is equivalent. So let's just see. Right now, it's working well. But I'm not going to say better than Factor 8 or worse than Factor 8. It's working well.
Can we give one more chance to Ladli? If there is disturbance, then we can mute.
Yeah, ma'am. Ramu sir wants to speak.
Yes,
Ramu sir.
इंदिरा मैडम आपका एक परमिशन से
Yes, sir. Yes.
आवाज आ रही है
आवाज आ रहा है।
बैकग्राउंड नॉइज अभी भी है, तो उनसे बात नहीं कर पाएंगे हम इस बार।
वो लाडली जी का, या
ओके फाइन।
रामू जी आप प्लीज कंटिन्यू।
रामू सर।
मैडम इंदिरा मैडम का परमिशन से एक मुक्ता मैडम कुछ बात करना चाहती थी, उन्होंने मैसेज किया था मेरे को।
जरूर
मुक्ता मैम कुछ अनाउंस करना चाहती थी, तो यस मुक्ता मैडम आप अनम्यूट करके बोल दीजिएगा। मुक्ता जी जायसवाल। एक्चुअली मैं भी कोर्स था, बट कोर्स से निकल गया तो मैं अनम्यूट ही नहीं हो रहा था, तो सौरभ ने अभी करा। उन्होंने कुछ आज कटक में कुछ महिला ग्रुप बनाया था, और नया वुमेन्स डे का दिन उन्होंने महिला। यस मैम प्लीज बोलिए। यस आगे।
हेलो इंदिरा मैम।
मैम बोलिए सुन रहा है, बोलिए।
हाँ बोलिए।
कटक चैप्टर में एक वुमेन्स ग्रुप में न्यू फॉर्म हुआ है वहां पर, तो कल उन्होंने कुछ मीटिंग रखा है वहां पे। अभी न्यू फॉर्म हुआ है, लगभग 12-15 लेडी हैं, तो एक वो वुमेन्स ग्रुप डेवलप करना चाह रही हैं, तो उसके लिए कल एक मीटिंग उन्होंने रखने के लिए चाहा है, तो आप रेडी हैं?
कल कितने बजे है?
आप जितना टाइम बोलो, 10 से 11 बजे।
मैं फ्री हूँ, आप जरा टाइम उनको कौन सा चाहिए, या तो मैं शाम को फ्री हूँ 5 बजे के बाद, 5 to 8।
मैडम आपको इंदिरा मैडम से 1-to-1 बात कर लीजिएगा, टाइम फिक्स करके आप बात कर लीजिएगा।
पर्सनल बात।
ठीक है। आपका जो स्पेशल अनाउंसमेंट था कटक में, उन्होंने आज महिला ग्रुप स्थापित किया, ये एक अचीवमेंट है ईस्टर्न रीजन में, तो वही उनको बताना था। तो कल आप
कांग्रेचुलेशन।
यस मैम, यस थैंक यू। यस
Yeah. Thank you, Ramu.
Thank you.
So now I request our Sunita ma'am to give vote of thanks. सुनीता
मुझे हाँ जी हाँ जी
हाँ।
मेरी आवाज आ रही है?
आ रही है।
आई एम ऑडिबल? हाँ,
या audible,
मैं
please.
वुमेन ग्रुप की ओर से हमारे प्रेसिडेंट मिस्टर प्रेमरूप अलवा जी, हमारे वीपीडी रामू गड़कर जी, मिस्टर सौरभ और अन्य लोगों को धन्यवाद देना चाहूंगी तथा सभी पार्टिसिपेंट को जिन्होंने इस कार्यक्रम में उपस्थित होकर हमारे कार्यक्रम को सुशोभित किया। और डॉक्टर रुचा पाटिल जी को थैंक्स बोलना चाहूंगी, एक तो इतनी वैल्यूएबल इंफॉर्मेशन दी, दूसरे हमारे पार्टिसिपेंट्स के जो भी क्वेश्चंस थे उन्होंने बहुत अच्छे से जवाब देके उनकी जिज्ञासा को शांत किया। अंत में इंदिरा जी और सत्या को भी थैंक्स कहूंगी, इन लोगों के सहयोग से ये कार्यक्रम बहुत अच्छे से हो पाया। थैंक यू एवरीवन।
Thank you Sunita ma'am.
Thank you.
Yeah, thank you Rucha
और
ma'am.
भी किसी के कुछ क्वेश्चंस है तो आप support@hemophilia.in में भी क्वेश्चंस दे सकते हैं। हम आपके क्वेश्चंस डॉक्टर रुचा जी मैडम को फॉरवर्ड कर देंगे और उनसे डायरेक्ट आपको भी जवाब आ जाएगा। यस, बहुत अच्छा सेशन था मैडम, थैंक यू।
Thank you so much.
Thank you everyone, and thank you.
Thank you
Dr.
everyone.
Rucha. It was an
Good night.
excellent webinar, and thank you for everyone's support for having this webinar successfully.
Thank you.
Sorry.